Everyone. Hi, everyone. This is Richard Mollett with the Long-Term Care Community Coalition. Welcome to today's program. Before we get started today, as you can see on your screen, we have some virtual meeting tips for the program. Please put all your questions in the Q&A on the little Zoom bar. Excuse me. Please use the chat feature to make any comments if you like, or to have a conversation. If you have any technical issues, please let us know in the chat and we will try to help you. But again, if you have any questions for the speakers, and we're going to leave time today at the end of the program for Q&A, please write them into the Q&A. Please do not raise your hand because we're going to be going through those questions as expeditiously as possible through the Q&A rather than through hand raising and rather than the chat. Before we get started, also on the right-hand side are some items new at Nursing Home 411, our website, including last month's webinar, Picking Patients for Profits, Admission Discrimination in Nursing Homes. We have new data on nursing home star ratings and antipsychotic drugging and some other issues, etc. Oops. There we go. And here's today's agenda. So I'm going to talk a bit about current federal staffing requirements. And then we have two extraordinary guest speakers today. I'm really so pleased. Sam Brooks and Lori Smetanka are joining us today from the Consumer Voice. Lori is the longtime executive director of the Consumer Voice. And before that, for many years, she worked as the director of the National Ombudsman Resource Center. And Sam Brooks is joining us. Sam Brooks is the manager of programs and policy for the Consumer Voice. And before he joined the Consumer Voice, I want to say 2 or 3 years ago, pardon me for not remembering exactly, Sam was an attorney with Aging and Disabilities Unit at the Community Legal Services in Philadelphia, Pennsylvania. And so after I introduce the federal staffing requirements and provide some background, Lori and Sam are going to talk about the new study from the National Academies of Science, Engineering, and Medicine on improving nursing home care in the U.S., and the proposed White House reforms, which are extremely important. And they'll talk about how you can respond to those requests for public comments. And this is really the first of a couple of programs that we'll be having. Today's program really is focused on staffing, and the Consumer Voice will be hosting another program that we'll be participating in, as well as Justice and Aging, Center for Medicare Advocacy, and the California Advocates for Nursing Home Reform. I believe it's next week, so you can check in with us or with them. They have information on that. That will talk about commenting on those important White House reform proposals. But today I really wanted to focus on staffing because, of course, staffing is so important, and I thought it'd be a good way to get the ball rolling. As I mentioned, the last item on our agenda is we will leave time for Q&A at the end of the program. So I'm going to get started with a little bit of background. But before I do, I just want to again let everyone know how excited I am to have Lori and Sam here, two of my favorite people that I get to work with, and Lori especially for many years now. So I'm going to talk again about a little bit of the background in terms of nursing home care, the standards, and specifically the standards for staffing. A little bit about LTCCC. For those of you who are not familiar, we are a nonprofit, nonpartisan organization entirely dedicated to improving care and quality of life for residents in nursing homes and assisted living and other residential care settings. We do virtually all of our work is policy oriented. So we do a lot of policy research and analysis and systems advocacy based upon that work. But more and more over the past, I would say 10 to 12 years, we've been doing public education for long-term care ombudsmen, for residents, and especially for families, and for people who work with residents and families to equip residents and families as best as possible with the information that they need to access the best care possible. And lastly, we're also, and certainly not least, we're the home to 2 local long-term care ombudsman programs here in New York State in the Hudson Valley. So a little bit of background. And again, this is very brief, but we have information on our website. The Consumer Voice also, of course, has information on their website to flesh any of this out. But to me, it's so important that we always come back to the 1987 nursing home reform law, which really set the standards for nursing home care in the United States. States can have additional rules, and most states do to some extent, or on different specific issues, but really it's the federal reform law and the federal rules that come out of that reform law that are the basis for care for every nursing home in the country that takes either Medicaid or Medicare money. The vast majority of nursing homes participate, as we call it, in both Medicaid and Medicare. The most important thing to remember about this law, and it's kind of a mouthful, is that the nursing reform law, all of the federal rules require that every individual who receives care and services in a nursing home receives sufficient and appropriate care in order, as I note in blue here, to attain and maintain their highest practicable physical, emotional, and psychosocial well-being. And it's really, I just want to spend a moment, it's just really important to think about it. It's something that I think about truly every day. It's not highest practical. It's not, I'm a nursing home owner and these are the amounts of staff I'm able to hire because I don't want to pay more, or I've had staff leave and it's hard to fill those positions. It's not based upon what the nursing home chooses to do based upon the owner or the operator's expected profit margin, what they're willing to do in terms of hiring staff, et cetera. The nursing home reform law, from my perspective, is really special in that it focuses on not on the operator, it focuses on the resident. And so it highest practicable means what that resident is able to achieve with the appropriate care and services. And importantly, as this comes from the law and the rules, and it's repeated over and over again, it's not just clinical, it's physical, it's emotional, and it's psychosocial well-being, recognizing over and over again throughout the rules that the nursing homes are charged with providing care for human beings, and often people who are, of course, quite vulnerable. The problem is that even though the law and the rules are strong, in essence, they're not self-implementing. They just because they exist doesn't mean they're realized in the lives of residents. They require enforcement. And unfortunately, as we've done numerous studies over the years, hopefully you're familiar with them, and they're certainly on our website, enforcement tends to be very weak. The state enforcement agencies and the federal enforcement agency doesn't do a great job in ensuring that the promise of the reform law is implemented in the lives of residents as required. A couple more points I want to make before moving on is that the standards apply to every single resident in the facility equally. So it doesn't matter if you're a Medicaid resident or a Medicare resident, or if you're paying privately or through insurance, you are entitled to the care and the services under the reform law, and the care and the services that the facility has promised to provide to you. A couple of key principles here. One is that the care and the services are based upon an individualized assessment and care plan. These are part of the federal rules. And again, they're designed to ensure that every resident is able to attain and maintain their highest practicable physical, mental, and psychosocial well-being. I kind of think of care assessment and care planning, as a 1-2 punch in terms of, so to speak, in terms of the residents' rights and what they can expect. In that, one is that the assessment has to be robust. It has to touch on a range of issues regarding a resident's needs, their goals, their background, et cetera, and that the care plan must be based upon that individualized assessment. So really important, because from there, that's how the facility is determining that it can safely accept a resident and how it can safely retain a resident. Again, ensuring that it is resident focused and resident centered. The regulations make clear that residents should not be declining unless that decline was medically unavoidable for that resident. And we see that over and over and over again. Again, really focusing today on staffing, because staffing is the basis for all of this care and for making it happen, but those rules are really important. And then lastly, I always want to note that for myself as well as, of course, for you all, is that quality of life and dignity are essential components of the standards of care. And too often they're ignored, but they are important, of course, for all of us as individuals, but they also relate in important ways to, and critical ways, I would say, to a resident's clinical well-being. You know, if we are depressed, we're less likely to eat, we're less likely to be active, and that in turn will, for instance, result in a decreased clinical well-being as well as emotional well-being. So I'm going to talk a bit about staffing and the specific staffing standards. And the reason why I wanted to start with this in our program today is because I think I can speak for Sam and Lori as well, is that we were really excited to see the president's proposal. Neither of our organizations are partisan organizations, but the president's proposals to reform nursing homes and to set a minimum numerical staffing requirement were really the first major advances or proposed advances in terms of improving nursing home care in, I would say, probably a good 40 years since the advent of the nursing home reform law in 1987. So it's really important that it's important to recognize and to participate in what is going on now, but it's also important to recognize that the law has always required sufficient staffing. The problem again comes to implementation. But what I wanted, the reason why I wanted to spend a couple of moments here in particular was to make sure that people know that we're not waiting around for good staffing to be required. Good staffing is required now. So here are a couple of the standards from the federal regulations. Nursing homes are required to have sufficient nursing staff with, as I note here in italics, with the appropriate competencies and skill sets. This comes directly from the federal rules and guidance to provide nursing and related services to assure resident safety and their ability to attain or maintain their highest practicable physical, mental, and psychosocial well-being. The facility must provide services by sufficient numbers of each of the following types of personnel: licensed nurses, RNs, and licensed practical nurses or licensed vocational nurses, LVNs, LPNs, as well as certified nurse aides on a 24-hour basis to ensure that nursing care is provided appropriately to all residents, again, in accordance with their resident care plan, which is why that care plan is so important. And then lastly here, and this is really just a summary of some of the important staffing requirements, a facility must be administered in a way that enables it to use its resources effectively and efficiently to attain or maintain the highest practicable, physical, mental, and psychosocial well-being of each resident. So the first two larger bullets relate to nursing staff. The last bullet that I include here is the rule regarding administration. And the reason why I included that is because we hear from families and from ombudsmen and from residents, and even sometimes from care staff over and over again, that the facility administrator is saying, well, this is the money that's been allotted to me for staff. Or I don't have the money. The corporate office says I can't hire more people, even though residents' needs are not being met. That's not acceptable. That is against the requirements for how facilities should be administered. And it's important for us to keep in mind, not memorize, but just to keep in mind that we have many, many levels of requirements and of expectations for nursing homes, from the ownership to the administration to the nursing staff, to ensure that nursing home residents' needs are met. So as I said, there's no need to remember this or memorize it. This is one of our fact sheets that, in fact, on the left-hand side, you could see pretty much gets at everything I was just talking about in regard to nursing services, sufficient levels of care staff, nurse aide competency. And on the right-hand side, you can see in those two green boxes, we have some considerations for resident-centered advocacy. This is a 2-page fact sheet. It's part of our fact sheets in the Learning Center on our website. Everything there is free to use and to share. And I'll just quickly, before I move on, just want to point out, in the purple writing where it says fundamental requirements for nursing services, and then it says 42 CFR 483.35, and then there's an F-725. Just very quickly, and there's a brief explanation at the top of the fact sheet. It gets a lot of this, I'm sure, to people who are not working on it every day, sounds like gobbledygook. Why did we include it here? And that's for two reasons. One is the 42 CFR, that's the Code of Federal Regulations. And the reason why we include this here on every single fact sheet is because we want people to know that it's not just, when I talk to family members or when I talk to ombudsmen, it's not just me saying something. This is not just my opinion. This is actually the federal rules. And by having that on the fact sheet, you can use that to support your resident advocacy. And then the F number is, what's called an F tag. And when a facility is cited, so say a facility is cited for not having sufficient staffing, that would be F-725. It's useful to have this number as a resident or family member or ombudsman or advocate, because if you're working in a facility or living in a facility, or your loved one is in a facility and they've been inspected, they've had a survey, and you can see that survey has to be available at the front desk, or you can see it online, and you see that it was a citation, that citation will have one of these numbers. That citation, if it was staffing, would have F-725, And so we want people to be able to take this information and use it for their advocacy. So if you see your facility was cited for F-725, you can come back to the fact sheet here and call it up and say, okay, this is what I have a right to expect. This is what is supposed to be happening, what is required to be happening, and the facility didn't do it. So it can give you a strong basis, again, for supporting your advocacy. Before I hand it over to Sam and to Lori, I have just a couple of things that might be of interest on our website. One is that we collect and we provide the staffing data in state files that are downloadable and easily searchable every single quarter. So every quarter, the federal government puts out staffing data for every single nursing home in the country that is in compliance with the federal staff reporting requirements. And we average that out, we break it down to help people understand what is going on in their state and in their community and their nursing homes. So this is one way we have a file that, a page that has all the different states, as you can see here, and that goes down. And we also have a map, so you can just click on your state and get directly to the staffing data. And this is just an example. I live in New Jersey, so this is what it looks like for New Jersey, but you can see on the upper left-hand side, you can filter by county, as I do on the next page. So this is the county I live in, is Essex County, New Jersey. So this is the list of nursing homes. Very quickly, and we provide a lot of different information, but you can see here, we start with total nurse staffing, hours per resident day, total direct care staffing. So the nurses are all the nurses in the building. The direct care are the nurses assigned to provide care. And we do the same thing for RNs in the next column. So you can see how much direct care staff time each facility is providing for the quarter on average. And you can see, I'll show in the next slide, you could also search by city. And so I included Montclair and West Orange, the two towns closest to me. And I actually sorted it here. If you can see column F, total nurse staffing, HPRD, hours per resident day, I sorted it from high to low. So if I was choosing a facility for a loved one, if I was looking to see, well, how does my facility compare to others in the area, I could easily do that just based upon nurse staffing. It's a little bit of useful information. And again, this and the fact sheets, et cetera, are all available on our website, nursinghome411.org. And you can sign up for alerts, nursinghome411.org/join. And without further ado, I am going to turn it over to Lori Smetanka. And thank you, Lori.
Thank you, Richard. And hi, everyone. It's great to be here today. And I'm so glad to be with all of you. Can you see the slide on the screen, Richard? Could you just let me know?
Yeah.
Great. Glad to be with you today, and really appreciate the partnerships that we have with the Long-Term Care Community Coalition. Richard and Eric and Haley have been such a great group to work with, and we are so delighted to have such a close partnership with them, and really love to complement each other's work, and they do such terrific work. So thank you for having us here today. And am joined today by Sam Brooks, my colleague, who's a program and policy manager. As Richard said, we're going to be talking about some of the latest proposals and new things that have come out around staffing, but just a little bit about the consumer voice. We are a national nonprofit advocacy organization. We work with and on behalf of residents who receive care and services in long-term care facilities. And if you could go to the next slide, please, Eric. We work to, we also are a nonpartisan group. We work with a variety of folks and partners, and as I mentioned, with and on behalf of the individuals who are receiving care and services. And the way that we do our work is we advocate for public policies that support quality care and quality of life, mostly at the national level, but we also support advocates at the state and local levels as well. So we are engaged in the development of public policy. We work to empower and educate consumers so that they are equipped and empowered to advocate for themselves, to know what their rights are and know what their expectations should be when they're receiving care in a long-term care facility. We work to train and support advocates, including long-term care ombudsmen and others who are advocating on behalf of residents. We also house the National Long-Term Care Ombudsman Resource Center, and we promote the critical role of staff and best practices at facilities, because as we know, staffing is the key component for ensuring that residents are receiving the best care possible. Next slide, please. So as Richard mentioned, in late February, the Biden administration released a set of proposals related to reforming nursing homes. And we were very excited to see them because they addressed a number of long-standing problems that have plagued nursing homes for decades, things that we've been advocating for decades. And many of the problems, which as you've heard about before through webinars that Richard has done, and if you've listened to webinars that we have done, really exacerbated some of the things that we saw happen during the pandemic. So a number of the proposals will address those issues. And if you could go to the next slide, please, Eric. They also address issues that arose during the pandemic. So we boxed out here for you a number of the different provisions that are covered through the reforms, including things like reducing unnecessary medications like antipsychotic drugs that are inappropriately used too often for residents, enhancing enforcement and inspection activities, and providing additional accountability and transparency of owners and operators of long-term care facilities, and things like requiring an on-site infection preventionist and looking at those requirements and addressing emergency preparedness. So there's a whole range of proposals that have been put forward. But what we're going to focus on today are the staffing proposals, and I've put those in the lighter blue on the left-hand side. But if you go to the next slide, we'll talk about them in a little bit more detail. So one of the cornerstones is the fact that these proposals put forward and will lead us to a minimum staffing standard. And, it's really unbelievable to those of us that have been working in this field for such a long time that we don't have a federal minimum staffing standard, a baseline, because research has shown, and we're going back decades here, that that staffing is a key component to ensuring positive resident outcome and quality of life for individuals. There is a direct correlation between the quality of care that a resident receives and the staffing levels in a facility. We saw that before the pandemic. We saw it during the pandemic, where facilities that were better staffed had better RN presence, for example, as well as nurse aide presence in a facility, experience better outcomes for residents with respect to COVID. But we don't have that federal staffing standard, despite the fact that in 2001, a CMS Commission study did suggest that we needed a federal minimum staffing standard of a minimum of 4.1 hours per resident day. And the research has shown that if you go below that minimum, quality of care is compromised, as well as nursing homes being put at risk for negative outcomes. So what these proposals will do is first lead us through a staffing study that's supposed to be completed within the next year. And CMS is starting the process of getting to work on the staffing study. But the results of that study, and they're doing it in order to assess what are the minimums that are recommended for putting into place, what's the mix of staff that should be available in facilities in order to ensure the highest quality of care for residents. That's looking to really update the latest data that we have, which is from the 2001 study that was the most comprehensively done for CMS. And then the results of the study are then to be taken, and CMS will then be developing proposed regulations to propose a minimum staffing standard that will be put into place. And what CMS has said is that they'll be proposing rules within 1 year of the announcement from February 28th. So we should be looking at shortly after the new year in 2023, looking for regulations to come out with a proposed minimum staffing study. The levels that we're looking at definitely need to take into account resident needs and acuity, but we've been advocating for so long for a minimum standard because what we know is that there's really a baseline below which you should not go. And without having that requirement in place, facilities, despite, as Richard said, there is a requirement for adequate staffing right now. You know, the law says and the regulations say that facilities must have sufficient staff to meet the needs of residents. That is just not being enforced, and facilities are not being held accountable for it because it's too loose of a standard. And so we have been advocating strongly for this minimum or baseline standard below which you cannot go. And then when you take into account the acuity, the needs of the residents, you would determine what an actual staffing standard should be. So in addition to a staffing study and a staffing standard that are required under the administration's reforms, there are some critical other components that they have proposed related to staffing, such as training of staff and job quality and wages and opportunity for advancement, because what we know is that that is also really critical for attracting people to this field, retaining staff, and improving job satisfaction. Right now, there's real concern about inadequate training for staff that are in facilities, particularly for nurse aides who have been subjected to waivers of staff training requirements during the pandemic, and the federal requirements related to 75 hours of training for nurse aides, we know really does need to be higher. So there's a push to look at offering affordable and reimbursable training for people who are seeking to become nurse aides through the proposals. The administration is also looking to support state efforts to make available free training opportunity and assist their efforts to tie Medicaid payments to staff wages and benefits, including providing additional pay for experience and for specialization or specific training that nurse aides may be able to glean through training programs in order to be an effort to focus on better jobs and enhance their skills and make them more not only available for meeting the residents' needs, but more equipped to meet residents' needs. And then the proposal in the Biden campaign is to look at and to promote a national career pathways campaign through CMS and the Department of Labor and other agencies, where they will be looking to recruit, train and transition workers into the long-term care field, because we know that we're experiencing extreme shortages of staff right now in the long-term care field. And part of the problem not only has been low wages, inadequate benefits, but also job quality. People have not been wanting to come into this field. And so there's going to be a real push to attract people into the field. Next slide, please, Eric. And as we, why do we need federal requirements? Again, I mentioned before the inadequacy of having just sufficient staff, it's too loose, but we also right now have left it up to the states to decide what the requirements are for staffing standards. And the Consumer Voice did a study last year of state staffing requirements. And what we found was really shocking in the sense that only one state, and DC, which I understand is technically not a state, but only one area required the 4.1 hours per resident per day minimum in their state requirements. All other states were fewer. And I mean, if you look at this chart, I mean, to have 2.0 hours or 2.5 hours per resident per day means that people are not getting the care and services that they need, and that they are not getting the outcomes that they need. And in fact, at least one state went backwards and reduced their staffing standard in the last year, and that was Florida. So we really do need a federal standard in order to hold facilities accountable, because they're not going to do it without having that. So next slide, please, and I'm going to turn it over to Sam to talk about the National Academy's report, which was recently released.
Great, thank you. Can you hear me? I just want to make sure. Okay, great. I was having microphone problems earlier. Hi, everyone. Thanks for having me here. And thanks, Lori. And thanks, Richard, Haley, and Eric for having us today. It's really an honor to be here to talk with all of you about this really important issue. And I'm going to jump right into it. And Lori commented and Richard commented about how excited we were to see the Biden proposals in the end of February. And at the same time, the National Academies of Sciences, Engineering, and Medicine were on the precipice or about to release their report. And to be frank, we were not sure how it was going to look. We just had this great information that came out from the administration, and then this report was released. And frankly, we were very, very pleased and quite surprised at just really how much of it affirms many, if not all, of the reforms that President Biden called for in his February 28th announcement. I strongly encourage you to look at it. It's long, it's lengthy, and it looks at really all aspects of care when it comes to nursing homes. But again, today we're just going to talk about staffing, but it's really a powerful document that can be used to advocate for many of these reforms that President Biden has called for. And importantly, it's really supported by studies and academics, and it was composed by some of the leading academic experts across the country. So I encourage you to take a look at it. And so we're going to talk today about the staffing portion of that. And next slide, please. And some of this might seem a little redundant to what Lori just said, but I'll try not to be too redundant, but just also highlight how these two things line up, the Biden reforms and the NASM report. So the NASM report really looks at staffing in the first part of its area on staffing. It looks at the issues, discusses various reasons why there's staffing problems, and then at the same time makes some proposals that they believe should be taken to address staffing problems. And one of them is a minimum staffing standard, similar to the Biden plan of doing a study. They call for a study and the implementation of a staffing standard, which is great. And it's supported by empirical data and facts. I mean, we all knew there needed to be a staffing standard, but now we have really the nation's leading academics calling for it as well. Importantly, they call for a 24-hour registered nurse. This is something that advocates have been calling for years. Currently, federal law only requires an RN to be present in a nursing home for 8 hours per day. And that is just really, really unacceptable. RNs are really the the backbone of lots of nursing homes. They have only certain training and only certain responsibilities that they could perform compared with, say, a CNA or an LPN. And they also recommended having a full-time qualified social worker and a full-time qualified infection control preventionist. Both of these are extremely important. We know around the social worker, we know that there is just an extreme lack of mental health and social supports for nursing home residents. And there is some significant research out there that shows that with those supports, residents do have better outcomes. And it's not hard to sell the qualified infection control preventionist. We've all seen what happened over the past couple of years and how devastating it was to nursing home residents. They call for infection control preventionists who's at least an RN, not just a CNA or someone that's taking on another task. A qualified person who has training in infection control and dedicates a lot of their responsibilities to that. Next slide, please. What's interesting about the NASEM report and kind of dovetails with the Biden administration recommendations is it looks at staff and why it looks at staff not just as something that is that we have to invest in for residents. We have to invest in to make staff and to make retention increase retention, excuse me. And it looks at it in a very empirical sense and looks at studies and looks at various models and comes up with some very concrete proposals and looks at, for instance, looking at wages and benefits. I mean, nursing home direct care staff are underpaid. CNAs provide more than care than any other staff per day. Yet, I think the median wage in 2020 was $14.48. That's $24,200 median income. 34% of CNAs rely on some kind of public benefits, be it SNAP, Medicaid. 41% live in low-income households. It's no wonder that we have a hard time retaining staff when these are the wages. RNs similarly are underpaid. RNs in nursing homes are paid roughly $72,000 a year compared with RNs in hospitals who are paid $85,000. That's an 18% difference. When we're asking so much of our workers and calling them heroes, yet paying them such diminished wages, it's no wonder that we have this just really high turnover in this crisis in staffing. It also looks at training, and training not only helps residents, but it also leads to better, more increased job satisfaction. And there's significant academic studies that support that. CNAs and other direct care staff who get training have better job satisfaction and are more likely to stay in their jobs. So not only do we want them to do their jobs correctly, we want them to be happy about it. We don't want them to be overwhelmed. And that's one of the most important parts taking away from this report. And career advancement, 9 out of 10 CNAs are women. 59% of them are people of color. But as you go up in the levels of management or the career levels in nursing homes, the number of people of color just diminish. And generally, the people of color who are staying in those most introductory CNA level jobs that there's no room for career advancement, and there's just increased churn of those low wage workers. And so they recommended, and this somewhat goes with the fourth bullet here, empowerment of CNAs, of creating career advancement, including CNAs in care planning, giving them opportunities to grow within an organization. And it shows, again, studies have showed when you empower CNAs or you give them opportunities to grow, you retain them. Because until we start retaining staff, the NASEM report says we're going to have this same problem. And that's what's really important about this study, is that it looks not only at the shortages, but why they are there and what we must do to address them. And I think one broad swath here, and they look at this particularly are inequities in the racial and social inequities within the direct care workforce, and talking about all of these things that, you know, that CNAs are made up of. Almost 6 out of 10 CNAs are people of color. When we lift up CNAs and we address these issues that we're talking about here, we're addressing, you know, decades of racial and social inequities, and that's a huge theme of this report. Next slide. So before we go on, I really encourage you to read that, go and read that NASEM report. It's really powerful. Wanted to graduating to something else here, and this kind of is back on the Biden reforms, is the Biden administration isn't joking around. They announced that they wanted to implement a minimum staffing standard within a year. And then on April 15th, they issued a notice of proposed rulemaking, which was over a 600-page document. But within that document, that touches on a lot of things, but within that document, one of the most important things in that document, at least probably the most important, is a request for information. And that request for information is specifically regarding the implementation of a minimum staffing standard. It gives, prior to the questions, it gives a long introduction talking about how much empirical evidence there is, how much to show that better staffing leads to better outcomes. And then talking about their plan to implement a staffing requirement. And then there's 17 questions. And to be frank, that within some of those questions, there's more questions. There it is layer upon layer of information, and some of it is redundant, and it can be pretty overwhelming. However, we're willing to help with that. But I'm not going to go through each one, but generally what the questions cover is, should we have a minimum staffing standard? What are the costs of it? What should it look like? How should we treat facilities that can't meet it? So there's some kind of broad ideas, and then there's some questions about just practical functioning of how the staffing standard should look. And just to be clear, this is a request for information. This is not a proposed regulation. They're just asking for information. And then subsequent, in about a year from now, hopefully they'll propose a regulation that will be informed not only by all of our requests, all our responses to this, but also the staffing study that they say should be doing. The comments for this, the comments or responses to this are due on June 10th of next month. So there's not a lot of time. Next slide. But the good news is well, there's a couple pieces of good news here. As Richard had mentioned earlier, Consumer Voice, along with LTCCC, did I do 3 C's? I might have done 4 C's there. Sorry, Richard, if I did 4 C's. Justice and Aging, Center for Medicare Advocacy, and California Advocates for Nursing Home Reform are going to be doing a webinar on May 25th at 3 o'clock. And what the webinar will do, will actually give model comments, and we'll go through a general overview of these questions. We won't have time to go over every one, but we'll go over thematically what they're about. But we will also give you some points on how to comment. This is generally a webinar that's tuned more to advocates, state and national and local advocates, organizational groups, but everyone is welcome to join. And what we'll be giving is just a set of model comments. The comments will be supported by citations to academic articles or to data, and people will be welcome to share that. We also, Consumer Voice also will be doing separately a more abbreviated, issuing some information on how to issue how to submit abbreviated responses. Not everyone's going to want to answer 17 questions with some of them having 2 or 3 within them. And the most important thing is that CMS hears from everybody that we need this and that we have to have a minimum staffing standard. So we'll be releasing some information on that too, about how to do that in the upcoming future. Thanks.
Thanks, Sam. In addition to responding to the request for information, which we would strongly encourage everyone on the call and listening in to do, there are other opportunities for advocacy because as those who are really working to improve conditions in nursing homes, we need to make the voices heard as to why we need reforms in long-term care facilities right now. And so it's important for you to be raising your voices and those of the people you're working with, those of residents and families, about what the impact on residents is now and why we need these reforms and to be put into place. Sharing personal stories, sharing what the impact on residents is really critical. And we need to keep the momentum going for why we need these reforms right now. There are big pushes, from the nursing home industry about why they can't do them, why they can't increase staff. They don't have the money. There's not enough people. But we can't just accept their arguments to be true because we know these things are critical. We know that by providing better care for residents, we lower costs of care. We know that we get better outcomes for residents. And frankly, that's what the law requires. And that's what residents are entitled to. And so we really have to be pushing that. You can share these different types of information and make your voices heard in a number of different ways, including on social media. And if you write for blogs or submit letters to the editor on why we need these reforms, email your letter and send letters to your members of Congress, letting them know that we need to change what happens in nursing homes and improve the quality of care. On the Consumer Voices website in March, we had done a March 4th campaign to really look at the reason why we need reforms and to give some action steps. And all of those different pieces are still there and they're still pertinent, where you can get template letters to the editor and a guide on how to write one, and even click in terms of how you can find the access to the media sources in your community where you can submit a letter to the editor or to submit a letter to your member of Congress. So if you click on that link on the slide right now, you can access that information. But it really is critical that your voices continue to be heard in order to continue to pursue the momentum for why we need these reforms in place. And so if you could go to the next slide, please, Eric. Just wanted to also say that there are a number of resources that we have produced from the Consumer Voice that also support why we need minimum staffing levels, why we need to really be focusing on this issue. There are some reports that we've released over the last year or so that really help to support these issues. And we have a podcast called Pursuing Quality Long-Term Care, where we've also been highlighting resident stories where you hear directly from them about why staffing is important and what it means for them when there's not enough staff to help provide their care. And you can access some of the most recent episodes that are from residents giving their own perspectives on the link that you see on the website. So with that, thank you. Our last slide is just a thank you with some contact information. And I'll turn it back over to Richard for other comments and questions.
Lori and Sam, thanks so much. That was, as always, thoughtful and important and valuable. I appreciate it. And as I think we've got some comments in the comments and some Q&A, those will be posted on our, I think they're already posted on our website, excuse me, the Kelly put them up. So you can visit the website for the for the 2 PowerPoints. Eric, are there any last things you want to say on our end?
Yeah, I'm gonna just navigating some PowerPoints right now. I'm gonna do a little plug for our next webinar and also give everybody a little homework assignment. So first, you're seeing the slide, I hope?
Yes.
Okay. So just a reminder, we have monthly webinars. Next up, we're going to be talking about antipsychotic drugging. It's the 10-year anniversary of a federal campaign that was that's goal was to reduce antipsychotic drugging, and what we're seeing is that it is still far too rampant in nursing home, and this has devastating effects on residents. So you can sign up for that with the link on the page, bit.ly/AP-drugs-2022, or you can take a picture, point your camera on the dinosaur for the QR code, and we'll be sending this out on our social media and our emails, so you'll get another crack at signing up for this. And relatedly, I just want to give everybody a easy A homework assignment, and that is to do one of the things on this page. So I know at every webinar, we're always asked, will this be posted online? Will there be video? Will there be slides? We do have slides up, and we'll post video later at webinar or nursinghomeforward.org/webinar-staffing-recs. But you can skip the middleman, and you can just subscribe to our YouTube channel. And that way, when we have a new webinar up, you'll be able to watch the recording there. You can also subscribe to our email list, and Haley will post this link on the chat. You can like our Facebook page, follow us on Twitter, and subscribe to our podcasts. And again, you can just do one of these things. It'll make a world of difference for our advocacy and for getting the word out as we are sharing resources like today's and advocating for resident rights. And with that, lastly, if you're an ombudsman and your program supervisor allows credit for attending this, you can fill out that survey, which we'll post in the chat on SurveyMonkey. And we also send out an automated email on Zoom where it will say that so-and-so attended this webinar by LTCCC, and you should be able to forward that to your supervisor. So that gets sent to people who attend. And if you didn't attend, you'll get an email saying, sorry you missed this webinar. But either way, if you registered, you'll get some sort of email. So with that, we're going to open it up to questions.
Great. So I can read it. We have three questions. The first one is from John Carton. Is the staffing requirement based on how many total filled facility beds or on a floor by floor basis, i.e. each floor defined as either LTC or STC? I'm not sure what STC is. But he says, my current loved one is at a 500 plus bed facility on one of the 3 or 4 LTC designated floors. On any given day, there are up to 40 patients on his floor, many of which are not ambulatory. The facility only provides 1 RN or LPN and usually only 3 CNAs. Their answer to why they don't have any more staff is they hire new employees, but they leave after being trained to other facilities for more pay, kind of getting at what Sam was talking about before. As of June 2018, public records showed this quote unquote not-for-profit facility paid their CEO $1.8 million as his annual base salary. So obviously there's money to increase staff pay. Lori or Sam, do you want to comment on that?
Sure. So when we talk about the staffing requirement, the one that's been proposed in previous studies looks at hours per resident per day. So it does look at how much care during the day should a resident get from a nurse, from a nurse aide, and that's how they come up with a resident should get 4 hours or 4.1 hours during the day of direct care from those individuals. That's hard to comprehend from those of us who, aren't really engaged in some of the mathematics that are involved in putting, that standard together. So we've also been talking with CMS about how do you translate that into a ratio of, how many staff should be available for how many residents in a facility, and what should that staff makeup look like? How many CNAs, how many nurses should be available for a number of residents on a floor, for example, or for a wing? And so that's what we're really looking at. And those are things that we need to be commenting on in the request for information that Sam talked about, what that should look like, that we need to make it understandable by consumers as well in terms of what they should expect. And also, I just want to make a point that, there's a real push when you look at what kind of staff are included in the staffing standard. From our perspective, it should only be nursing staff, nurses, registered nurses, licensed nurses, and nurse aides. While there is a real critical need for other types of staff, therapists, and other people, they should not be included in that minimum staffing standard. We definitely need minimum amounts of those other people as well. But when we're talking about a minimum staffing standard, it includes nursing staff.
That's great. Thank you. We have just a few minutes, so I'm going to move on. Wendy Bigelow, hope I'm pronouncing your name correctly, says, I love that we are addressing these issues at nursing homes. These are also a problem at memory care and assisted living facilities. These families see lesser nursing oversight, non-certified caregivers, and medication techs. Are these type of facilities also going to see some of these changes? Short answer is unfortunately not under current proposals, but Lori or Sam, if you have any comments on that? It's an issue, of course, which we have long shared concerns.
Mm-hmm. Yeah, it is an issue that we have concerns about. CMS's rules cover, as Richard said at the very beginning of the webinar, nursing homes that are certified for Medicare and Medicaid. They right now do not regulate assisted living or non-nursing home settings like assisted living or home and community-based care options, residential care facilities. So we need to look at state standards for that, but it's an area where we need to be advocating.
Yeah. Thanks. Sam, I didn't mean to leave you out. I don't know if there's anything.
No, I think that's right. Yeah.
Okay, and we have one more question from James Heinrich. Has there been a study on nursing facility profits? All the suggestions sound good and reflect most corporate staffing issues. The changes will result in increased costs. Any talk about increasing payments to nursing facilities, or is it assumed, that nursing facilities are making too much money?
I'm happy to answer that. Frankly, we don't know how much money nursing homes are making. I know we hear the constant refrain from nursing homes is that they don't get paid enough. Although we do know that it's a very lucrative business to many people who own and operate nursing homes. One of the cornerstones of the Biden administration reforms is transparency. Nursing homes received over $100 billion in 2020, and we have little or no idea where that money went. We knew it wasn't going towards staffing. There was no significant increase in staffing in 2020, despite all of this money that was supposedly go to help staffing standards. So frankly, we as advocates strongly believe that money is being taken away from care to pad the pockets of corporate owners or even now private owners that see this more as an investment opportunity rather than a way to make residents healthier and better. So until we know just how each facility spends its money, and we have a right to know that as taxpayers. I mean, this is Medicare. When you see people getting rich and buying yachts, it's with our tax dollars. So until we know just how this money is being spent, we will never be able to answer this question. However, we strongly believe that once transparency is added to this, and once facilities are required to show, who is taking profits, all these different related parties, we will see that really money that could be going towards care is not. And so it's hard to answer that question, but I think advocates for residents know it already. So yeah.
Thanks, Sam. I know we have a few more questions, but unfortunately we need to close at 2:00 today. So I will try to print them out and share them with Lori and Sam and and post those as well. So thank you everyone who joined us. Thank you, of course, Lori and Sam and Eric for the program today. And I hope you'll join us next month. Have a great
Thank
afternoon.
you. Thanks,
Thank you for
Richard.
having us. Thanks, everyone. Bye-bye.